All right, so for the bony palpations of the hip thigh pelvis, so first thing we have femur, long bone of the leg, iliac crest, so top of the hips, and then ASIS as well as AIIS, going to be on the anterior aspect of the ilia, and then we're going to have the greater trochanter, so side of the hip, and you can have them externally and internally rotate their hip if you need to feel it, but I can feel his predominant right there. And then we have PSIS, so again, it's going to be on the posterior aspect, and those are going to be the dimples in the back. And then we have the ischial tuberosity, so again, you'd have them lay down, and those can be palpated by going into the glutes, coccyx, tailbone. Then we have the sacrum, which is just superior to the coccyx. And we can have the sacral spinous processes. If we find the PSIS, and that automatically puts us at S2, so we just come medially, and those are going to be the spinous process. And the pubic symphysis is going to be the anterior articulation of the pubis, so that's going to be right here. And then for the soft tissue palpations, we're going to have the hip flexors, so off of the ASIS and the AIS, we have the sartorius, which is going to start at the ASIS, come across to the knee joint, iliopsoas, the main hip flexor, and the rectus femoris. And we have the inguinal, so ASIS to pubic symphysis, bisect, and also in that space down below 1 inch, it's going to be the femoral artery. Glute musculature, so we turn to the side, so this is easy to see. Glute medius is going to be that medial glute muscle. And it's going to be the iliac crest and the greater trochanter. Then glute maximus is going to be that large posterior glute muscle. TFL, tensor fasciae lata, is going to come around and curve around the hip. It's going to help form the IT band. And on the posterior side, we have the hamstrings. We have the biceps femoris on the lateral aspect. On the medial aspect, we have the semitendinosus, semimembranosus. Ischial bursa. That's going to be on the ischial tuberosity, so it's not going to be painful unless it's inflamed. Sciatic nerve, so that's going to be the greater trochanter and the ischial tuberosity, and you can have them have their knee on a chair to be able to, and you won't be able to palpate it because of how much muscle is there. And then we have the groin, we have the adductors, and medial aspect of the thigh, so the gracilis, and all the adductors, magnus, minimus, and longus, and those are the bony and soft tissue palpations.